Hello guys, how are you all? How is everyone doing? Hello Osama. Harshita, hi, good evening Harshita. Bhartiya, hello. Good evening Lipika, good evening Kiran Yadav, good evening. Devender Solanki, good evening. Right. So guys, one very important thing is that most of you in this session, and by the way this session is mainly intended for those students who are entering into MBBS first year, right? Whether it might be in India or in abroad, whatever it is. So I think most of you are really excited that you are entering into MBBS first year. But let me tell you one thing, that is a very good news. And second important thing is that this is the moment, right, from when you have to start your hard work. Okay, so from day one of your MBBS class itself, you have to start working hard. Rather than telling a start working hard, I have to use the word passion. Okay, so you have to be so passionate from day one itself. And believe me that if you study every day with a lots and lots of passion, and every day is going to be really wonderful for you, you will really enjoy this journey of the MBBS, okay, or the medical sciences. So so if you see here, thank you so much Najmul, thank you so much. Right. So if you see here, guys, that within the first year you have got many subjects. Okay. So myself, Dr. Krishna, and I'll be teaching you anatomy. Okay. And anatomy, for most of the students, it is a terror, right? Because there are a lot of terms which you don't understand. So, but that is real. The important thing you need to know is that anatomy is a separate language. Okay, so you have to understand the basics. Why? Because these basics, they keep on repeating as we'll be discussing the topics. Okay, so for that, such basics we shall be discussing today. Okay, we shall start from the complete basics. So by the way, tell me which medical college or which country are you getting into? Are you taking admission into? Yeah. Hi Pushpalata, Ritik, hi. Okay, so Kyrgyzstan, very good, very good. So Devendra is getting into KSMA, very good. Caspian, which is in Kazakhstan, right? School campus, and Patan School campus is a very beautiful campus. Trust me, if you haven't seen it, but that is a very beautiful campus, right? Kurdistan, Abbas, Georgia, very good. So very good, guys. So what we shall do is that we shall start discussing completely from the basics. Okay. So if you see here, one very important thing that, see here, in anatomy there are a lot of things. Okay, so lot of things, like let us say lateral, let us say medial, anterior, posterior, superior, inferior. So there are a lot of terminologies. Okay, so if you clearly understand the terminologies, not only understanding, you just have to imagine. Anatomy is all about imagination. Okay, so if you clearly imagine all these terminologies, then I'm telling you, this is gonna be, you're gonna love this subject a lot. Okay, so let us start from the complete basics, that is from the history itself. Okay, so from the history itself, yes, yes Patan. So after this, after once when you get admission over there, right, so I'll be teaching you anatomy over there, right? Not only there, in other countries also. So the first important thing we shall be discussing is regarding the history here. The first important history, the first important guy we will be discussing here is Hippocrates, right? So as you can see here, that Hippocrates is a Greek physician, right? And he is also considered as a father of medicine. And Hippocrates has given an oath, and that oath is called as Hippocratic oath. I hope all of you know about this Hippocratic oath, right? So worldwide, everywhere they are using this Hippocratic oath, but recently in India, we are not using this Hippocratic oath. Okay, so instead of this Hippocratic oath, what oath we are using right now in India is we are using Maharshi Charak Shapat. Okay, so right now in India we are using this Maharishi Charak Shapat. Fine, yeah, the notes, you'll get the notes in the Telegram group, don't worry about that. Yeah, yes, I'll be also teaching in East School campus also. Very good. So this is the thing. And second important, one interesting thing right now, guys. So don't comment down now. I'll interact with you in a minute. But before that, just listen to whatever I'm telling. Now, very important thing you need to know is that this guy, Hippocrates, has given a very interesting theory. Okay? वो interesting theory क्या है? He has given about 4 body humors. Now, what do you mean by 4 body humors theory in the sense? इसने ये बोला कि there are 4 different types of fluids that are released in your body. So what are these 4 different types of fluids? One is called as blood, another one is called as phlegm, another one is called as yellow bile and black bile. So what are these fluids? First of all, in those days what they used to believe is that in any person, if these fluids are released, right, each fluid will show up a typical behavior in that person. For example, if blood is released in me, right, so this blood, whatever this blood ka fluid jo hai na, this fluid whatever is there, that will make me optimistic, that will make me sociably clear, right, or in a sociable nature. Second important thing is that phlegm, right, they told that phlegm is kind of a fluid that is released from the brain, or they also told that it is also released from the lungs, right. So if in you this phlegm is released, what will happen? This will make you calm. Okay, so this fluid will make you calm and easygoing, है ना? In the same way, there are 2 more fluids like yellow bile and black bile. For example, yellow bile is a fluid that is released from the liver. Okay, so this was their thinking, this was that theory. They told yellow bile was released from the liver. Okay, and what does this yellow bile do? This yellow bile will make you energetic. It will also make you attractive and optimistic. है ना? अगर ये yellow bile ज़्यादा हुआ, right? What will happen? This will make you aggressive and disturbed or irritated. Okay. In the same way, there is something called as black bile, which is released from the spleen. Okay, so if this black bile is more, then you will end up having a lot of sadness and depression. So this was the theory which was proposed by Hippocrates, है ना? ये उस time पे propose किया था, but right now they have debunked this theory. This theory is not at all existing क्योंकि इसका कोई proof नहीं है. Okay, so these are the 4 important things. All of you understood, guys? Blood, phlegm, yellow bile and black bile. All of you understood this? Yeah? Very good, very good, very good. So next important scientist we're gonna move here is, next important one is Herophilus, right? Now there are very interesting things about this Herophilus, guys. He is considered as Najmul. I was telling you regarding phlegm, right? This phlegm matlab, this is one type of fluid. Okay, they used to call phlegm is a type of fluid that is released from the lungs. Okay, for example, if phlegm is more, right, so this phlegm will make you calm, easygoing, है ना? So it will make you completely still. You're getting it? It will make you completely relaxed. So this is something that is their belief, right? So we didn't study about this nowadays because this theory is completely debunked. They have removed this theory. Okay, right. Now next important thing is that regarding this scientist, if you see father of anatomy, you know what he used to do? What he used to do is that VV sections. What are VV sections? You know what he used to do? He used to pick up the prisoners from Alexandria as well as Egypt. Okay, so in these countries he used to pick up the prisoners. Almost he picked up around 600 prisoners. Okay, पिकअप करने के बाद he used to dissect them lively, और वैसे उस टाइम पे there was no anesthesia and all. right? So he used to dissect them lively and he used to kill them. Okay, so how many people did he kill him? How many people did he kill? He killed around 600 live prisoners. Okay, and what did he do? Whatever studies he have made, all of that he have compiled in 7 to 8 volumes of books. Okay, but the reality is that the fact is that he lost all of those books. Okay, so that is the thing, that he has done vivisections. He has done vivisections, and not only that, dissections of cadavers also. All of you know what is a cadaver, right? So get ready to touch the cadaver, right? And next important thing is that he is regarded as a brain. He regarded brain as a seat of intelligence. He is the first person who told that brain is a seat of intelligence. Okay, and all of you in your +1 +2 you have studied what is cerebrum, what is cerebellum, what are ventricles, right? So he is the guy to describe about cerebrum, about cerebellum, and there is a ventricle called fourth ventricle. Okay. Next important thing is that he is the first one to identify nerves as sensory and motor. All of you know this. You have studied in your +2 that spinal cord may the dorsal, the upper part is always sensory, the lower part is always motor. You studied it, right? So he is the one to explain that the dorsal is always sensory and the ventral is always motor. Okay, so this is all about Herophilus, which you need to know. Now, after this, the next important thing is Vesalius. Now, what did this Vesalius do is that, guys, most of them, they used to believe his writings, है ना? उस time पे, you know, there were a lot of misconceptions in the anatomy. For example, some of the scientists used to tell that the length of fallopian tube is 11 centimeters. कुछ लोग ये बोलते थे कि no, वो 11 centimeters नहीं है, it is 15 centimeters. So there were a lot of misconceptions. But this Vesalius have studied the anatomy in such a way that his writings, his books are so accurate that all those misconceptions used to be corrected. So worldwide, that powerful his books were, his literatures were. And how many literatures, how many volumes did he compile this entire anatomy? Into 7 volumes, okay? And the name of all these volumes is De Humani Corporis Fabrica, okay? So he revolutionized the teaching of anatomy and ruled for 2 centuries. That is why he is called as father of modern anatomy, okay? He's called as father of modern anatomy. So this is something about the history which all of you have to know. Okay, this is not, I mean, sir, ये exam में पूछा जाएगा क्या? No, they won't ask you these things in exam. But as you are right now entering into MBBS first year, I cannot go and directly teach head and neck, upper limb and all, right? So, right. Next important thing is that first day in your MBBS, they're going to teach you what are the different types of anatomy. Okay, how many ways you can study anatomy. So these are some of the different ways which you can study anatomy. For example, if you are studying anatomy on a cadaver, that anatomy is called as cadaveric anatomy. Okay. If you are cutting a part of that cadaver, putting it under a microscope and studying the tissue, okay, that is called as histology or microscopic anatomy. Okay. If you are studying from where this human body originated, right, from the start point matlab from the day of conception till the complete development of the fetus, है ना, ये सब कुछ, ये जो story है ना, this is called as embryology. Okay, so that is called as developmental anatomy or embryology. In the same way, you have got living anatomy also. In the same way, you have got clinically applied anatomy. Clinically applied. Now, this is very important. This is very important, kyunki, guys, remember one thing, you along with Indian students, right? So Indian students are gonna write next exam. You who are studying in abroad are also gonna write next exam. So there is no difference in both of you, right? But difference should only be in the way of preparation, right? Here in India, they are taught with complete clinical basics. So there, when you go there, I want all of you to study everything clinically. Every topic you choose, there should be a clinical point. Relate it with a hospital scenario. Okay, because that is what they're going to ask you in your exams. That is what is called as clinical anatomy. Okay, but anyways, as we shall be discussing the clinical anatomy and all, you will understand what I'm trying to tell you. Okay, Next, if you are studying about the brain, spinal cord and all, that is called as neuroanatomy, right? So how many of you wanted to become neurosurgeons, guys, here? How many of you wanted to become neurosurgeons? And no one wants to become? Right. So the next anatomy is surface anatomy, or also called as topographic anatomy. अभी ये topographic anatomy क्या है? What is topographic anatomy is that by palpating the bony points, right? By palpating the bony points, you will tell which organ is located in which position. Okay. For example, by looking at the bony points, itself, I can tell that here I have got my spleen, right? And here I have got behind these ribs, here I have got my liver. You're getting it, right? So, you know, there are most important pulses in your body. One of the pulses, femoral pulse. So by palpating some of the bony structures, which we shall be discussing later on, you can very easily locate the femoral pulse. Okay. So this is nothing but called as topographic anatomy. Just listen to whatever I'm telling. You need not to remember it. This is just an introduction. Okay. और उसके बाद radiographic anatomy. Radiographic anatomy is all about X-rays, CT scans, MRIs. Right, you go to a hospital right now, you are normal, I know. You go to a hospital, take a MRI scan, there will be a scan that will be coming out, right? The anatomy which you are studying there is called as radiological anatomy or radiographic anatomy. Okay, right. Next important thing is subdivisions of the body. So even in your textbooks, any textbook you pick up, right? Any textbook, I'll also tell you what are the textbooks you need to take before you enter into your first year, right? So any textbook you see, the entire body is divided into sections. For example, head and neck, this is discussed under a single chapter. Okay, upper limb matlab ye dono. Upper limb is discussed under one chapter. Lower limb is discussed under another chapter. Thorax is discussed separately. Abdomen is discussed separately, and pelvis is discussed separately. Okay, so these are called as the subdivisions of your body. So what are the subdivisions? Are head and neck. Head and neck are one chapter, right? So here you have got thorax. Here you have got upper limb. UL matlab upper limb, and always you know, you have to get addicted to these shortcuts. Okay, so get comfortable with these shortcuts. Next, LL matlab lower limb. Okay, and this part over here is called as your abdomen. Okay, and this part over here is called as your pelvis. So these are the different kinds of regions in the body. Guys, you're understanding, right? All of you are clear to whatever I'm saying? Everyone wants to become a neurosurgeon, right? That is a long journey. Don't worry about that. Right. Very good, Najmul. And remaining all are understanding. Anjali Joshi, you are understanding. Riya Singh, Lipika, Ritik, you are understanding, Ritik. Cheguri, Raju, Princey, all of you are understanding, right? Very good. Very good. Chalo. Now, whatever I'm gonna tell you guys, abhi tak jo bhi bola tha, this is just an introduction. Now, whatever I'm telling you, this slide, or based upon this slide, your entire anatomy is there. What is that? That is, what is a normal anatomical position of your body? See, the way she's standing, this is a normal anatomical position of your body. Okay. For example, if I'm standing like this, right? Whatever, I mean, I cannot stand here, obviously. So if I'm standing like this, whatever you can see on the front face here, all this is the normal anatomical position. Okay. Whatever you can see is called as anterior part, or you can also call as ventral part, anterior or ventral. Now, whatever you cannot see, what you cannot see my back, that is called as a posterior part or dorsal part. ठीक है, सामने जो दिखता है that is anterior or also called ventral, पीछे जो है that is called as posterior or dorsal. Now, whatever you can see on this lady, this is the anterior part or ventral part. Whatever you cannot see is a posterior or dorsal part. So this is a normal anatomical position. So let us see, if you have to call a person standing in a normal anatomical position, what are the features you see? ठीक है, पहला feature ये है कि standing upright. You have to stand upright first of all. Okay, looking straight towards the horizon. You have to completely look straight. You cannot look like this and tell this is an anatomical position. No, you have to look straight. Next, upper limbs are hanging by the side of the body, right? You cannot put like this, right? And you cannot put one hand in the pocket, one hand behind your head and tell that this is an anatomical position. No, always both your upper limbs have to lie side to side of your body. Okay, palms should be faced downwards. Okay, and lower limbs are parallel with toes pointing forward. So as you can see, these are the lower limbs with toes are pointing forwards. You cannot put your lower limbs like this. You cannot stand stylely like this and tell this is a anatomical position. So these are the 5 important features to tell that a person is in an anatomical position. Clear, all of you? Right? Because why? Because whatever you will be studying, everything you will study according to anatomical position only. Okay, so if you keep this picture in your mind, automatically if I talk about any other bone or an organ, you will automatically understand whatever I'm talking. Okay, hi Vanilla, Ria Singh, very good. Okay, right. The next important thing after anatomical position is this thing, that is planes in your body. Abhi dekho, yahan tak questions they never asked. But regarding the terms of planes, there are different types of planes in your body. They have asked a question once in AIMS and in NEET PG also they have asked. Okay, so let us see what are these planes. Okay, ye dekho. One plane, hi Bhushan, how are you? One plane is called as mid-sagittal plane. Okay, S for sagittal, S for straight. Now see, for example, if I am drawing from here, right, if I'm drawing a line like this from here, from the center, completely along the center line, I'm drawing a line here. Now if you are cutting my body like this, if you are cutting my body, then my body is divided into right half, left half, yes or no? And both the halves are equal or unequal? Both the halves are equal. So this kind of section, you call it as mid-sagittal plane. Okay, so as you can see in the picture also, there is mid-sagittal plane. ठीक है, इसका दूसरा नाम है मीडियन सैजिटल प्लेन. ओके, दिस इज वन इंपॉर्टेंट थिंग. हाय, हेलो मेहनास, हाउ आर यू? So what is mid-sagittal plane? It is a vertical plane dividing the body into right and left equal halves. ए equal का word जो है ना वो बहुत इंपॉर्टेंट है. ठीक है, अभी इसके बाद क्या है? What is the next thing? Next thing is sagittal plane. Then what is the difference between mid-sagittal and sagittal? See, mid-sagittal is exactly in the midpoint. Sagittal matlab little bit right or little bit left. For example, little bit right from the midpoint. Okay, here if I am cutting my body, if I am making a section like this, obviously in this section also two halves, right and left, but this right and left halves are not equal, they are unequal. Yes or no? They are unequal. That kind of section you call it as a sagittal section. Okay, just side to the median sagittal plane, you have got a sagittal section, right? I hope you understood these two important things. Hello, Matt Booster, how are you? I hope you understood these two differences, right? I can also call sagittal as parasagittal. You know, parasagittal. Okay, para matlab jante ho kya? What is para? Para is anything which is side from the midpoint. Okay, this is a pencil. Right? Anything which is on the right, anything which is on the left is called para. Okay? So if I'm making a line here, this is para, this is also para. So we are done with two important things, guys. Now the third important thing is coronal plane or frontal plane. Coronal plane or frontal plane matlab, instead of dividing my body in this way, if you are dividing my body like this, right, from side to side or from lateral to lateral, I will tell you what is lateral and medial. Right? Let us talk in a simple language, from side to side, or let us say from right to left or left to right. If you are cutting my body like this, what is happening? What is happening is that my body is divided into and front part and back part. ये जो front part सामने hang हो रहा है ना, this is called as an anterior part, and this part which is falling back, this is called as a posterior part. You're clear with this? Very good, Najmul. Najmul is telling front half and back half. Very good. You're right. Okay, it is divided into front half and back half. That is called as coronal section. Clear? That is called as coronal section. Next important thing is transverse plane. ये yellow color में जो line indicated है ना यहाँ पे, this is called transverse plane. If you are cutting my body like this, like a section, this is called as a transverse plane. All of you might have seen MRI scans, CT scans, right? So in the CT scans and all, the body is cut into different sections or slices, right? So you study each slice, yes or no? Right? I hope you understood whatever I was trying to tell you, है ना? Right. Now guys, मैंने बोला था ना, वॉट एवर यू आर स्टडिंग यू हैव टू स्टडी इट क्लिनिकली इंटीग्रेट करना पड़ेगा, राइट? यू कैनॉट जस्ट मग इट अप. ओके, मग इट अप का बिजनेस हो गया इन +12 itself. Right now MBBS you have to clinically correlate everything. I'll show you those examples how to clinically correlate. ठीक है? First important thing, look at this patient over here. Right now I am telling you that this patient is having dystrophy. अभी ये dystrophy क्या है? What is dystrophy? For example, in your +1 +2 you have studied that structural and functional unit. What is that? Cell, है ना? All the cells will join together to form tissue. Tissues form together to form organs, है ना? You know this thing. Let us say ये tissue है. Let us say my hand is a tissue, for example. ठीक है? Now this tissue is made up of some thousands and thousands of cells. Out of these thousands and thousands of cells, I am telling you few cells are degenerated. Degenerated मतलब destructed, damaged. ठीक है? इसको बोलते हैं dystrophy. This is called as dystrophy. If you look at this patient, the classical example is skeletal muscular dystrophy. Okay? All of you look at a skeletal muscle. Do you find bones here, right, which are protruded more out or which are more prominent, or muscle is more prominent here? There is no muscle mass itself. क्यों? क्योंकि muscle cells जो है ना, myocytes, they have already degenerated. You understood now what is dystrophy, right? So dystrophy मतलब degeneration. Dystrophy is nothing but degeneration of specific cells in one or more tissue. Okay, so one very good example I'm going to give you is skeletal muscle dystrophy. Skeletal muscle dystrophy is a very good example. I think guys, I hope you know what is the skeletal muscle dystrophy, right? In my +1 +2 you studied. Here you will study much more detailedly what is this skeletal muscle dystrophy and all. ठीक है? Now compare dystrophy with atrophy. अभी ये atrophy क्या है? Atrophy means dystrophy is destruction. Atrophy is not destruction. Atrophy is muscle tissue is there, right? In you and me, the muscle tissue is normally developed. In me, the muscle tissue is normally developed. But if I'm not using the muscle, for example, out of left and right hand, right, I'm not at all using my right hand. I'm not at all lifting my right hand, right? So this is simply like a dead hand, for example. So क्या होगा? Gradually over years, if you are not using the muscles here, these muscles will shrink. That shrinking of muscles or wasting of muscles is called as atrophy. Okay, that shrinking or wasting of muscles you call it as atrophy. यहाँ पे आप देख सकते हो कि ये right leg है and this is left leg. Look at the calf muscles. Najmul, become weak नहीं? Every case, even in dystrophy also it will become weak. Weakness is something different. Okay, weakness is something related to neuronal problems. Okay, जब nerve damage हो जाएगा उस टाइम पे जो पेशेंट को सिम्टम्स आएगा ना, उसमें से वीकनेस एक सिम्टम है. ओके, सो बट एनीवेज आई कैन अंडरस्टैंड व्हाट यू आर ट्राइंग टू टेल यू, बट यू आर राइट. So right and left leg. Look at the calf muscle. Which calf muscle is normal? Right leg or left leg calf muscle is normal? Very fastly answer now. Very good. Excellent. Left leg calf muscle is normal. तो right leg का calf muscle क्या हो गया? It's got shrunken. Okay, shrunk हो गया पूरा. So this is called as atrophy. So what is atrophy? Atrophy is nothing but shrinking or wasting of tissue or organs. Okay, shrinking or wasting of. Very good, Patan, very good. Rishit, Osama Sheikh, Mehnaz, Sudatri, very good Sudatri. Karma, very good. Afroz Khan, Pathan Afroz Khan, very good Pathan, very good. Right. Now compare dystrophy atrophy. I hope you understood a clear cut difference between dystrophy atrophy. इन दोनों को compare करो with the third thing, that is hypoplasia. अभी ये देखो, we shall just divide this term, ठीक है? Hypoplasia, plasia क्या होता है? Plasia मतलब development, hypo मतलब under. देखो, there are two terms, one is hypo, one is hyper. Hyper मतलब over, हाइपो मतलब अंडर. सो यहां पे ये बताओ हाइपोप्लेजिया मतलब क्या है? हाइपोप्लेजिया मतलब अंडर डेवलपमेंट. ओके, हाइपोप्लेजिया इज नथिंग बट कॉल्ड एज अंडर डेवलपमेंट. ओके, एंड वेरी गुड, नजमुल इज टेलिंग इनकम्प्लीट डेवलपमेंट. वेरी गुड, इनकम्प्लीट ग्रोथ. ठीक है, अंडर डेवलपमेंट और इनकम्प्लीट ग्रोथ. ग्रोथ ऑफ व्हाट? ग्रोथ ऑफ टिश्यू और ऑर्गन. Guys, all of you can look here. All of you can look here. This man, नहीं नहीं, ये breast नहीं है. He is a man. He is a male. ठीक है? He is a male. This is not breast. ठीक है? So this man, if you look here, all of you know what is pectoralis muscle. This basic thing you know, right? Pectoralis muscle. वैसे जिम में भी पढ़ते हो, right? So on the left side there is pectoralis muscle, but right side पे देखो pectoralis muscle नहीं है. It is absent. Not absent actually. It is underdeveloped. है ना? So this condition where one side pectoralis major muscle is not developed and one side it is well developed, this condition is called as Poland syndrome. ठीक है, ये याद रखो आपसे. This condition is called as Poland syndrome. ठीक है? So from today onwards, if someone is asking you what is Poland syndrome, right? You have to answer them that one side मतलब यूनिलैटरल बोलते हो कि बाइलैटरल बोलते हो? यूनिलैटरल. यूनिलैटरली देयर इज एब्सेंस ऑफ पेक्टोरालिस और अंडर डेवलपमेंट ऑफ पेक्टोरालिस मेजर मसल इज कॉल्ड एज पोलैंड सिंड्रोम. ठीक है, वेरी गुड. वेरी गुड, राइट. वेरी गुड कर्मा, वेरी गुड ओसामा, थैंक यू. राइट. Next important thing and the last important thing which you see here is aplasia. ठीक है, I will tell you. No, Najmal, this is a male only. This is a male patient. Okay, you can see the hair also here. This is a male patient. Okay. Now what I will do is that I will tell you what is aplasia. इसके बाद I will show you X-rays and you will diagnose and tell me. Let us start. Let me make you doctors from first year itself. ठीक है? If you diagnose the X-ray right, then definitely my belief is that you are gonna become better doctor. Hello. Guys, am I audible now? I'm really very sorry. Am I audible now? Yeah, very good. चलो ठीक हो गया, fine. चलो, let us get back. Okay, let us get back to this. What is aplasia? Aplasia is nothing but absence, है ना, completely गायब होना. Absence or failure of development. Absence of failure or failure of development of a tissue. Okay. So what I was telling you, I was just Rishit, I'll repeat it. What I'm trying to tell you is that what is aplasia? Plasia is nothing but called as development. Okay, aplasia matlab absolutely no development, right? For example, if you cut the skin and look inside for something, whatever you wanted to see, there is nothing, right? Simple example I'm giving you is for the clavicle. Okay, so you can palpate both the clavicles, but in some of the patients, the clavicle is completely absent. You know, even there is not even a little bone also. So completely no clavicle on one side, or sometimes completely no clavicles on both the sides also, right? So that condition you called as A matlab no plasia development, no development at all. Okay, so all of you can look at these two patients over here. These two patients over here, if clavicles are the one which are putting your shoulders broad apart, है ना, अगर clavicle नहीं है तो क्या होगा, दोनों shoulder tips they touch each other, yes or no? The same thing is happening here. This is how the patient is coming to the clinic, right? So this condition, guys, this condition, it will be little bit difficult to know the name, but it will be fine. That is क्लीडोक्रेनियल, इसका नाम है क्लीडोक्रेनियल डिसोस्टोसिस. ठीक है, the name of this is cleidocranial dysostosis. Sir, this can be due to muscle flexibility? No. Suj, no. Very good question. This cannot be because of muscle flexibility, because we have bones, right? You cannot overcome the bone. Okay, so cleidocranial dysostosis. ठीक है, पता है एक बार ये क्वेश्चन पूछा था, if clavicles are absent, why the shoulder tips are touching each other? The reason is, if clavicles are absent, ये pectoralis major है ना, this pectoralis major muscle is pulling the right shoulder, this pectoralis major is pulling the left shoulder. Both the shoulders are coming towards each other and both of them are touching each other. Okay, so that is the reason here. Now you will tell me which is cleidocranial dysostosis, which is a normal X-ray. Okay, fine. Patient number 1, right? Patient number 2. Now tell me, patient number 1 is normal or is he having absent clavicles? बताओ. This is an X-ray. इसको बोलते हैं X-ray PA view. PA view मतलब postero anterior view. Very good, Surya Prakash. Very good. Patient 2. Surya Prakash answered fastly. Very good. Lipika. Very good. So patient 1 is normal. ये देखो clearly, देखो यहाँ पे आपको, can you see the clavicles over here? See, you can see the clavicles on both the ends, but यहाँ पे देखो there are no clavicles, right? So any patient is coming, doctor, my both the shoulder tips are touching each other. What test will you tell? What test will you order? Will you order go get a complete blood count, go get an MRI, go get a CT scan? Will you order that, or will you just order a simple X-ray of chest? You will just order a simple X-ray of chest. Okay, right. So till here, I hope you understood. Now let us move on to the next important thing. Guys, till here, all of you understood whatever I've told you? Yeah, Lipika, Surya Prakash, Osama Sheikh, Mehnaz, Pathan, Afrid Syed, Sudatri, Jay Siddharth, all of you understood, right? Kiran Yadav, where are you? Not at all commenting. Riya Singh, Vidyat, Madhava Sena Raidu, you understood Madhava? Mansi Patel, Shrishti, all of you are understanding, right? Very good. Chalo, let's look at the next important thing. This thing I have already told you. What is the thing? Whatever you can see from the front face is anterior or ventral. Piche jo hai, that is posterior or dorsal, right? So all of you look here. This facing, right? This facing, whatever is there, this facing is called as anterior facing. ठीक है, और एंटीरियर सरफेस बोलते हैं इसको, ओके, एंटीरियर सरफेस. बैक साइड वॉट एवर यू कैन सी, दिस इज कॉल्ड एज पोस्टीरियर सरफेस. पोस्टीरियर सरफेस, एंटीरियर सरफेस एंड पोस्टीरियर सरफेस. ठीक है. Second two important things you need to know, every time which is on the top is called superior, which is on the bottom is called inferior. Okay, so top superior मतलब ये देखो, this is superior, ठीक है, और ये जो नीचे है ना, this is inferior. Sir, these things are very easy, we studied in +1 and +2. Tell something that is very difficult for us. I'm telling you, this slide whatever I'm going to explain you right now, right, even MBBS second third year students also till today, few of them, not all of them, few of them find difficulty in learning medial kya hota hai, lateral kya hota hai. That's a very confusing part. So I'll tell you one small trick, right? Just remember that whenever a context of medial lateral comes, just remember the things which I've told you. Okay, now in this patient, right, in this person, what I'm going to do is that I'm going to draw a vertical line here. Ye dekho, I'm going to draw a straight vertical line all the way from top to bottom. Okay, this line is called as median line, jo center mein hai. After that, can you see three dots here? All of you can see three dots. Now this dot, let us say dot 1, dot 2. Dot 1 is towards the midline. Yes or no? Dot 1 is towards the midline. So dot 1 is called as medial. Dot 2 is away from the midline. Dot 2 is called as lateral. Okay. So dot 1 is towards the midline. You call it as medial. Dot 2 is away from the midline. You call it as lateral. You call it as lateral. Okay. Now let us take another example, guys. Another example, don't comment, all of you look here. For example, if I'm putting my hand like this, है ना, ये देखो, ये midline है. This is midline, right? Now here you can see one surface, you can see another surface, but this surface is pointing towards the midline. So this should be called medial or lateral. This should be called as medial. Okay, अभी ये surface जो है ना, this is pointing laterally or outward from the midline. This is called as lateral. Clear, all of you, right? And second best example is, all of you look at the eye. See, this is this part and look at this part. See, this surface of the eye, whatever is there, this surface of the eye is towards the center line. So this part is called as medial angle. और ये जो है ना, away, this is called as lateral angle. I hope all of you understood what is medial and lateral now. This is all about medial as well as lateral. Okay. Very good, Cherogi. Very good. Yes, Rishit, it is necessary that the line should be in the mid. Okay. It is necessary that the line should be in the middle. Okay. So now what we shall do is that, guys, here if you see, we will discuss the shapes of muscles. Okay, there are different shapes of muscles. What are the different? See, in your botany, in your zoology, right? Specifically in your botany, you have studied regarding the leaves. You know, you have studied unipinate, bipinate, multipinate. You remember that, right? So you remember all those things. All midline are called medial. Yes, towards the midline are called as medial, Sujit. Anything towards the midline are called as medial. Okay, anything towards the midline are called as medial. You have studied unipinate, multipinate, bipinate, hai na? The same things will apply here, but these are not leaves, these are muscles. Okay, so you will have different kinds of muscles. So all these are the different kinds of muscles. We shall discuss one by one with a single example. Okay, here देखो, the first muscle, if you look at this, guys, इसका shape बताओ, triangle है कि quadrilateral है? Obviously the shape is quadrilateral, right? Now look at the real muscle also here. Even the shape of this muscle over here is also quadrilateral, right? So one group of muscles are called as quadrilateral muscles. Okay, so the name of this muscle is pronator quadratus. Pronator quadratus, right? Some of you might know what is pronation. Right, I hope now you can listen to me, right? Am I audible to all of you now? Chalo. So the muscle is like a strap, it is stretched out, है ना? So these group of muscles are called as strap muscles. So where are these strap muscles? Now all of you look at this neck here. So you have studied something called hyoid bone, है ना? ये देखो यहाँ पे ये thyroid cartilage है. Thyroid cartilage के नीचे यहाँ पे जो bone है ना, this is called as your hyoid bone. Yes or no? You can palpate the hyoid bone. So this hyoid bone over here, hyoid bone के नीचे anything below is called infra, anything above is called supra. फिर से anything below is called as infra, anything above is called as supra. So ये hyoid bone है, right? All of you know that this bone over here is your hyoid bone. Anything below the hyoid bone, can you see these muscles, guys? These muscles are lengthy like this, lengthy like a strap, right? So these muscles are called as strap muscles. So Najmul and Sudatri, I was just telling strap muscles matlab muscles which are lengthy, okay? These muscles are called as strap muscles. So the same example ko yahan pe na relate kar lo aap log. What I was telling you is there is some bone called as hyoid bone, है ना? Hyoid bone के नीचे anything below is called infra, anything above is called supra. So all these muscles, let us say muscle number 1, 2, 3, 4, 5, 6, all these muscles are below the hyoid. So tell me, should I call infrahyoid or suprahyoid? Batao. Should I call them as infrahyoid or suprahyoid? All these muscles? I have to call, very good. I have to call them as lipika, infrahyoid. Infrahyoid. Surya Prakash, infrahyoid. Just now I told you anything below the hyoid bone is called infra, anything above the hyoid bone is called supra, superior, right? Supra. Infra, inferior, supra, superior. Remember like this, okay? So if you can see, if you can look at the muscles also, all these muscles are straight like a strap. You know? This is one muscle, this is another muscle, right? I hope you understood now. Now the third group of muscle is this one. Now all of you look at this. All of you look at this muscle. See, it is like a strap only. The muscle is like a strap, but beach mein na there are tendons. ये देखो, muscle is like a strap, but बीच में क्या है? There are tendinous intersections. ठीक है, बीच में tendons है. Now look at this muscle here. All of you look at this muscle. So there is a muscle, and in between, what is this? Tendon. Now where is this muscle? This muscle we see in the abdomen. है ना? ये देखो. You can see this muscle over here. This is the muscle, right? This is a strap muscle with tendinous insertions. ये देखो tendon है ना, white color वाला, tendinous insertion. So this is called as a rectus abdominis muscle. Okay, this muscle is an example of rectus abdominis. Rectus abdominis. Sir, why are you calling it as rectus? Rectus matlab Latin mein straight. Obviously this muscle is straight. And where is this muscle? In the abdomen region. So abdominis. Rectus abdominis. Clear all of you? Very good, Najmul. Abs pack, but textbooks mein na abs pack karke nahi diya hai. Okay. What they have given is rectus abdominis only. You have to just learn like that. ठीक है? Chalo. Next important muscle is this one. What is the shape of this, guys? The shape of the muscle is fusiform. In your botany also, you will study some plants, some roots, right, which are fusiform shape. Yes or no? Even the same, the muscles are also fusiform shape. So kaun sa muscle hai jo fusiform shape hai, you see? Is it relating? Is the picture relating here or no? This is what? Biceps muscle. Okay, what is this muscle? This muscle is called as biceps brachii. Biceps brachii. ठीक है? Sir, इसको biceps क्यों बोलते हो? Why am I calling it as biceps? Because there are two heads. There are two heads. ये देखो. This is head number 1. This is head number 2. Okay? You see 1 and 2. There are two heads, so I call it as biceps muscle. ठीक है? Very good. Very good, Surya. Surya Prakash. Very good, Mandru. Very good. Second important thing is tricipital. Why are you calling it as tricipital? Because I'm having three heads. See, 1, 2, 3. है ना? Tricipital muscle कौन सा है? Triceps is called tricipital. So this muscle over here is called as triceps. Okay. This is your biceps. On the back you have got triceps. Okay. Clear all of you? Very good. Mandru Sanjay is telling 3 heads. Very good. 3 heads. And Surya is telling 2 heads. 2 heads for biceps. Very good, Surya. And this is 3 heads. Very good. This is called tricipital. Okay? So tricipital के बाद क्या आएगा? All of you look here. Triangular shape muscle. What is a muscle that is triangular shape? All of you know. Here we have got a muscle that is called deltoid muscle. है ना? These are some of the things which you already know. Deltoid injection देता ना, intramuscular injection. Right? You put a 90-degree shot here. Deltoid injection. ये देखो, this is triangular and you can also very clearly see that the muscle is triangular. So this muscle over here is your deltoid muscle. Okay, this muscle is your deltoid muscle. Yes, Sujit. Yes, Sujit. We have got lateral head, we have got medial head, we have got long head. Okay, triceps में we have got long head of triceps, lateral head of triceps, medial head of triceps. Okay, when I will be discussing upper limb, I will tell you. चलो, triangular के बाद next क्या है? Cruciate. Cruciate मतलब it is single muscle only, but this muscle is having 2 bellies. है ना? Single muscle having 2 bellies. ये 2 bellies. मान लो this is entirely single muscle. 2 bellies are there. 1 belly is overlapping on other belly. This is called cruciate. यहाँ पे एक बार देखो, all of you. You can, if you very clearly see this muscle, whatever is there, ये देखो dotted lines जो डाल रहा हूँ ना, this is one muscle. Another belly of the same muscle is this one. Okay, so what is this muscle over here, guys? This muscle is sternocleidomastoid muscle. Okay, so all of you, when I'm turning the neck here, you can see this muscle here, right? This neck muscle is called sternocleidomastoid. Why are you calling it as sterno? क्योंकि ये sternum पे attach हो रहे. Why are you calling it as cleido? Because it is also attached to clavicle. Why are you calling it as mastoid? Because it is attached to this bone called as mastoid bone. So sternocleidomastoid muscle. Okay, that is a cruciate muscle. Clear all of you? So let me write it down. Sternocleidomastoid muscle. Okay. Sir, this muscle is attached to skull. हाँ, exactly behind your ear. Skull के पीछे, guys. So let me show you this thing. Let me show you this thing over here. Behind the skull, you know, you have got this process here, right? Behind your ear here, if you palpate, you can see this bony projection. This is called as mastoid process. This is called as mastoid process. So from the mastoid process, ये muscle जो है ना ऐसे आएगा. Okay, this muscle comes all the way from the mastoid process like this. Okay, that is why it is called as sternocleidomastoid muscle. And by the way, this is a real skull. You're gonna touch this real skull soon. Okay, chalo, sternocleidomastoid. Now we will enter into unipinate, bipinate and multipinate. Okay, unipinate क्या है? There is only one pinna. Bipinate मतलब there are 2 pinnas. Multipinate मतलब there are multiple pinnas. If you look at the muscles of the hand, okay, the intrinsic muscles मतलब deep muscles of the hand. If you carefully look, guys, here, how many pinnas are there? You will tell me now. Okay, you will tell me how many pinnas are there. See, this is a muscle with a single pinna. This is a muscle with a single pinna. But look at this muscle 3 and 4. It is having 2 pinnas. Yes or no? ये देखो, it is having 2 pinnas. Here also it is having 2 pinnas. So can I tell muscle number 1 and 2 are unipinate, muscle number 3 and 4 are bipinate? Yes or no? Muscle number 1 and 2 are unipinate, 3 and 4 are bipinate. अभी ये 1 and 2, 3 and 4 क्या है? These muscles are called as lumbricales. Lumbricales में 1 and 2 are unipinate. Okay, 3 and 4 are bipinate. Okay, all of guys in your +1 +2 you studied about this parasite called Ascaris lumbricoids, है ना? You have studied about Ascaris lumbricoids, है ना? What is ascaris lumbricoids? That is a worm. See, look at these muscles also. These muscles are also like worms, right? Worm like muscles or ascaris lumbricoid like muscles are called as lumbricales. From where did the name lumbricales come? Because these muscles, they look like ascaris lumbricoid, though that is why you call them as lumbricales. Okay? So first and second lumbricale are unipinate, third and fourth lumbricale are bipinate. Claro. Okay? ये देखो bipinate मतलब two pinnas are there. Obviously you know. ये देखो two pinnas. Where are the two pinnas? So this is a single muscle having two pinnas. Okay. So single muscle having two pinnas like this. Clear? So this muscle is your bipinate muscle. Very good. After bipinate muscle, the next important muscle we have is spiral muscle. ठीक है? अभी ये what is this spiral muscle, guys? What is this spiral muscle? Before we come to spiral muscle, let us finish up this multipinate part and then spiral muscle. ठीक है? Multipinate मतलब many pinna. Okay? If you look here, tendon कितने tendons है? White part is called tendon. There is only one tendon, but how many pinnas are there? 1, 2, 3, 4. Okay? The same thing. ये देखो, only one tendon over here, but how many pinnas are there? 1. ये देखो 1, 2, 3, 4 and 5. So can I call this as a multipinate? Right? So what is the name of this multipinna? Rishit, very good. The name of this multipinna is subscapularis. Subscapularis. Okay? Subscapularis मतलब scapula के नीचे. Okay? Scapula. Scapula के नीचे, you call it as subscapularis. Clear? Right. Now if you look at this muscle, that is called as spiral muscle. Look at this muscle, that is called as spiral muscle. Why it is called spiral? Because this muscle is spirally rotated, so you call it as spiral. You know? Now all of you just look at this muscle which is located on the back. ये देखो, this muscle all the way it is going and attaching to the back. Okay, it is going and attaching to the back, right? Scapula. So this is the muscle that is going from the back and attaching to your arm. Now isn't it spirally rotated? If you look here, isn't it spirally rotated? ये देखो, this is spirally rotated. Okay, this is spirally rotated. Okay, so this muscle is called as latissimus dorsi. Latissimus dorsi. So latissimus dorsi is an example of what? It is an example of spiral muscle. Okay, latissimus dorsi is an example of spiral muscle. So all of you are clear? Alright, by the way, guys, tell me, are you all understanding? Yeah, guys, are you all understanding, right? Very good, guys. I'm really happy that you are about to enter into first year MBBS and you are really understanding it. Very good, very good. Right. Now after discussing all the different kinds of muscles, see, we are done discussing quadrilateral, है ना? Strap muscle, strap with tendinous insertions. Now you will tell me what is a muscle that is strapped with tendinous insertions. कौन सा muscle है? Give me one example. Najmul will give me the example now. Najmul will give me the example. Yes? Right. Osama, Sudatri, Gampala, Afreet, Cheguri Princy, Jay Siddharth. Strap with tendinous insertions, that is abdominal muscle. I told you, what is that? Rectus abdominis. Very good, Srishti. Srishti answered first, rectus abdominis. Okay, tell me, Afreet, abs pack nahi. Exam में abs pack नहीं लिखना चाहिए. Okay, you just have to write as rectus abdominis. ठीक है, rectus abdominis. So tricipital, what tricipital कौन सा होगा? वेरी इजी, वेरी 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 इजी वन. ट्राइसिपिटल कौन सा होगा बताओ. वेरी गुड, ट्राइसेप्स. लिपिका, पद्मिनी, वेरी गुड, ट्राइसेप्स. ठीक है. अब ये बताओ मल्टीपिनेट कौन सा होगा. व्हाट इज मल्टीपिनेट? एग्जाम्पल ऑफ ए मल्टीपिनेट मसल. एग्जाम्पल ऑफ ए मल्टीपिनेट मसल. बी फास्ट. वेरी गुड, सबस्कैपुलरिस. Subscapularis. ठीक है. So guys, all of you look here. This is scapula, है ना. This is your scapula. So below the scapula मतलब नीचे. This is the lower part of the scapula. So from here till here this muscle is attached and this muscle is called as subscapularis muscle. Okay, this muscle is subscapularis muscle. So this is the ventral side. ये जो है ना dorsal side है. Okay, this is the ventral side. So this muscle here is subscapularis muscle. Right. Now the next important thing we shall discuss, and this is a very easy part. ठीक है, ज़्यादा time भी नहीं लगेगा. Very easy part. Say two ways you can show your hand. One is this one, and this is another face. है ना. What is this face? When I'm telling this face, again you are coming back to normal anatomical position. Normal anatomical position में मैंने क्या बोला था? This is the face, right? Now whatever you can see, this is the anterior or this is called as a ventral. ठीक है. अभी इसका तीसरा नाम भी है, पता क्या? पाल्मार सरफेस बोलते हैं इसको. This is called as palmar surface. Okay, exactly back of this is called as posterior or dorsal surface. Okay, so here A is called as anterior surface, anterior or palmar, anterior or palmar. Okay, और ventral भी लिख सकता हूं ना. I can also write it as ventral. This one B, tell me the names of B. One is called as posterior or dorsal. Okay, Najmul, not prone and supine. This is not prone and supine. Prone and supine is a different scenario. I will tell you what is prone and supine. So this is posterior or dorsal, anterior palmar or ventral. Okay, clear all of you? This is not prone and supine. Prone and supine is the position which you are sleeping. Okay, for example, if they wanted to do any kind of abdominal surgeries, then will you sleep like this or will you sleep in this way so that your face is facing the sky? Right? So if I'm sleeping like this, this is called as supine position. Okay, if I'm bending like this so that you can operate my back, this is called as prone position. Okay, if I'm sleeping like this, prone. If I'm sleeping like this is supine position. Clear? So here it is anterior or posterior, dorsal, ventral. Okay. Now the same thing come to the leg. When it comes to the leg, now guys, all of you should remember this thing. This is a little bit confusing part. Hai? What is this confusing part is? See, all of you don't comment now. Just look whatever I'm teaching you. Okay. Ye dekho. Here, this part I called it as anterior part or ventral part. Okay, anterior part or ventral part. But when you are coming down here, this part over here, okay, this part is called as the dorsum of the foot. This is called as a dorsum of the foot. Always remember, opposite of upper limb is lower limb. Okay, opposite of upper limb is lower limb. Anatomical position mein, where are my thumbs? My thumbs are looking inward or my thumbs are pointed outward? My thumbs are pointed outward. But in an anatomical position, look at the toes. The toes are pointing inward. है ना? क्यों? क्योंकि as the development is taking place, what happened is that within the fetus, the upper limbs turned 180 degrees outside and the lower limbs turned 180 degrees inside. इसीलिए toes जो है ना, they are inside and thumbs जो है ना, they are outside. You got it? That is why upper limb is always the opposite of lower limb. Okay? So with this concept, what I want to tell you is that here, this part is called as the dorsum of the foot. This is called as the dorsum of the foot. Dorsum of the foot. Okay? This is called as a plantar surface. इसको क्या बोलते हैं? Plantar surface बोलते हैं. This is called as plantar surface. One is called as a dorsal surface. Another one is called as a plantar surface. Okay, dorsal surface and plantar surface. So I hope till here you are clear. Okay, now ये जो what is this palmar? The same thing in the lower limb is plantar. Okay, this is palmar, that is plantar. Now you will tell me the answer, guys. What is this position called? Okay, what are these positions? You will tell me the answer. This is an exercise for you. Okay, all of you just look at this. You know now what is anterior, what is posterior, what is superior, what is inferior, है ना? Now, yes, Tamil speaker is telling, is plantar also called as ventral? Yes, it is plantar is also called as ventral. Why? Because I told you upper limb is opposite of lower limb. Okay, so now all of you look at this. All of you know that there are 2 points here. One point is on the buttocks, one point is on the knee, right? All of you know this is anterior, this is posterior. All of you know this is superior, this is inferior. Now, if I'm talking about this point specifically, right? Now you will tell me, compare this point with the lower red point. The point which is on the top, isko superior bolte ho ki inferior bolte ho? You should call it as superior, right? So what I'm telling you is, I have to call this as superior. So superior plus, it is on the back or it is on the front? It is on the back, posterior, है ना? Superior plus posterior. So this point is called as supro-posterior or posterior-superior. This point is called as posterior-superior. Posterior-superior. Okay? Posterior-superior because it is posterior and on the top. Right. Now you will tell me what is this point called as. Right? What is this point here? How should I name this? Come on, comment fast. How should I name this thing? Very good. Tamil speaker, antero-inferior. Very good. All of you understood, guys? Ajmal, you understood? Rahman, very good. Surya Prakash, Shrishti, very good. Antero-inferior. Very, very good. So this part is antero-inferior. Very good, guys. I'm really happy. Antero-inferior. Okay? Right. Now let us move on to the second exercise. ये देखो. In this second exercise, what did I tell you? मैंने क्या बोला था? I told you always draw a line in the center. है ना? First of all, let us draw a line. ये देखो. I am drawing a line in the center. है ना? Now, there are 2 points here. This is point number 1. This is point number 2. Point number 1, point number 2, compare karo. Which is superior? Point number 1 is superior. So, superior plus point number 1 is towards the medial line or away from the medial line? It is towards the medial line. Superior plus medial. So, मैंने इसको क्या बोलूंगा? This is called as supromedial. What is this called as? Supromedial. Superomedial. Now, you will tell me what is point number 2 called as? Batao. What is point number 2 called? No. Point number 2. Surya Prakash. Very good. Inferior-lateral. Very good. Very good. Very good. So you understood, guys, how to combine 2 different terminologies, right? So you understood this, right? Fine. Very good. Now let us come to flexion extension. Now this is one of the tricky part that students find difficulty to understand. Simple thing, ye dekho. For example, this is my elbow joint. Okay? What I'm doing? I'm doing some action. मैं कुछ action कर रहा हूँ यहाँ पे. Right? I'm bringing my elbow joint. I'm bringing my wrist, right? So wrist towards my nose like this. Okay? So when I'm doing like this, ये जो angle है ना, from the forearm and arm, forearm और arm के बीच में ये जो angle है ना, this angle is reducing or increasing? बताओ, ये angle reduce हो रहा है कि increase हो रहा है? This angle is reducing. Always remember, reduction in angle is called flexion. अगर angle बढ़ रहा है, if angle is becoming more, that is called as extension. Okay? So if I'm doing like this, ये देखो, angle कम हो रहा है, angle is becoming less, this is called flexion. Now when I'm doing like this, what is happening? Extension. So flexion of elbow, extension of elbow. Okay? The same things. Now I'm making a fist. When I'm making a fist, what is happening? This is called flexion. Flexion of all my digits. ये देखो, now what I'm doing? I'm extending them. This is called extension. Okay? Decrease in joint angle, Najmul, very good. Decrease in joint angle is called as flexion, right? So let me write as decrease in joint angle. Decrease in joint angle is called as flexion. Opposite is increase. Increase in joint angle is called as extension. Okay? That is called as extension. Circumduction क्या होता है? For example, if I am rotating my arm like this, right? So this is called as circumduction. मतलब circular motion को circumduction. Very simple, है ना? This is very simple. Right. Now next important thing, what is abduction, adduction, है ना? Even the final year medical students also, they get confused sometimes. Abduction क्या होता है, adduction क्या होता है? क्योंकि दोनों terms they are similar, they are sounding similar, है ना? So how do you remember right from day one of your MBBS? ये देखो, remember it as lab, okay, and bad. Just two words. एक है laboratory, एक है bad laboratory, okay? Now look here. What I will do is that again I will draw a line like this, center line, dissecting her body. Okay. Now after drawing like this, what do I mean by B? B matlab body, right? B matlab body. For example, if I'm putting my hand like this, right? What do you mean by body? Body matlab you bring your hand all the way towards your body. Towards your body matlab towards the midline. You know? So if you are bringing your hand towards your body, that is called adduction. If you are moving your hand away from your body, away from the midline, that is called as abduction. In the picture here, you can very clearly see, right? If you are putting the hand away, this is called abduction. This is called as adduction. L stands for lateral. Laterally, if you are moving, that is called abduction. Towards the body, you call it as adduction. Okay? Now, I will tell you one thing. You will answer me. Okay? I will show you something and you will answer me. Now these are my fingers, right? Now all my fingers are moving away from each other or separating away from each other. You see, take sir, where is the midpoint? यहाँ पे ये देखो, take a middle finger as a midline. ठीक है? Middle finger को take it as a midline. Now after taking middle finger as midline, now look, I'm separating my fingers like this. अब ये बताओ, ये adduction है कि abduction है? All my fingers are moving away from the midline, away from the midline. This is called abduction or adduction? बताओ. Very good, very good, very good. Vaidik, Lipika, Afrid, Ria, very good, Surya. This is called as adduction, right? This is called as abduction. Very good, abduction. If all my fingers are coming towards the midline or the middle finger, this is called abduction. Sorry, adduction, right? This is called as adduction. Very good. So you understood what is abduction and adduction. Okay, let us continue now. Right? Now you will tell me, guys, patient A, patient B. Okay? Patient A is showing which? Very good, Jay Siddharth, very good. Now all of you just concentrate here. Patient A is showing which action here? Is he showing abduction or adduction here? Yes, I wanted to know whether patient A is showing abduction or adduction. Very good. This is the midline. ये midline है ना? All the fingers are moving apart. So this is lab. Very good. Abduction. Okay. And patient B is showing adduction. Very good. Very good. Perfecto. है ना? Sir, why do we need this? Are we going to do any kind of circus activity? No. The reason is when you get back into the hospital, right, most of the patients will have damaged the muscles here, right? If a patient is heavily drunk and let us say drunk and drive case, right? So he met with an RTA, road traffic accident. He came to the hospital on, let us say, Saturday night. You are the doctor on duty. Okay? His hands are completely broken out. Okay? So all his fingers are all crushed. That is called as a crush injury. Now what you tell to the patient? To see whether his nerves and muscles are working, You tell the patient to do this action, simple action. If he is not able to do, इसका मतलब क्या है? इसके अंदर जो nerves है, muscles है, they are damaged. Okay, and you know, second thing, what is the treatment you do if there are fractures here? There is something called K wiring. Okay, you put it in a Bosch machine and you start drilling it like this. Okay, you give anesthesia in between the web spaces here and you catch hold of the finger and drill the patient like this. Okay, so that is the thing which you do. Anyways, we shall be discussing much more of these things later on. Don't worry about that. Right. So let us look at these things now. Let us look at the thumb. The most important thing is thumb. Thumb might be short, okay, but it is very, very tricky. Yeah, dekho, what are the actions of the thumb? Now all of you tell me that whatever I'm doing now in this action, the angle is decreasing or increasing? Ye batao. When I'm doing this action like this, the angle is increasing or decreasing? The angle is decreasing. Decrease in angle is called as flexion. है ना? So this is called as thumb flexion. इसका opposite जो है, this is called as thumb extension. Okay, this is called thumb flexion. This is called as thumb extension. Okay, don't comment, guys. Just look whatever I'm telling. Thumb flexion है ये, thumb extension है. Now look here. I have taken middle finger as a long axis. है ना? Now I am moving my thumb towards my middle finger. If I am moving my thumb towards my middle finger, I should call it as abduction or adduction. Towards my middle finger matlab towards my body. Body is bad, right? AD matlab adduction. Very good. So this action is adduction. I am moving away. This is called as abduction. So what are the actions of the thumb? एक होगा flexion, एक होगा extension, एक होगा abduction, एक होगा adduction. ठीक है? And there is one more function also. See, what you can do is that you can count the fingers. Here देखो 1, 2, 3, 4. It means your thumb is going opposite of each and every finger. Right? Your thumb is going opposite of each and every finger. This action is called opponents. This action is called opposition. What is this action called? Opposition. So, what are the different types of actions which you see in the thumb? एक होगा flexion. ठीक है? Flexion के बाद क्या होगा? Extension. Extension. After extension, what do you have? Towards the body, adduction. Away from the body, abduction. Hands are up. Hands are up matlab. So hands are up like this. Even if it is, even if the hands are up also, you are taking middle finger as a long axis, right? So abduction, adduction won't change. Okay. So adduction and abduction, and next कौन सा है? Opposition. Opposition मतलब क्या? Counting the fingers. ये देखो, you are counting the fingers, right? So this is called as opposition. So these are the actions of the thumb, right? Even if the arms are up also, the same function remains the same. Okay? Even if the arms are up also, function remains the same. See, that is the time when your anatomical position will kick in. Even if your hands are up, right? If you are in an anatomical position, this is your anatomical position, right? If you are in anatomical position, abduction and adduction will not change. Okay? Right. Second important thing is, all of you love to promise. We promise very easily. So when you promise, how do you promise? You promise like this or you promise like this? Obviously you promise like this. So this action where you are promising is called pronation. Pronation is promising. When you are receiving something, this is called supination. Okay? Again, this is called as pronation. This is called as supination. Promising is pronation. Lying back like this, opposite of that is supination. So all of you look here. All of you look here. So this promising is called pronation. This is called as supination. Okay? This is called as supination. After that, now I cannot show my foot in front of the camera. Okay? But instead what I will do is that, think this is my foot. Okay? This is my foot. Now in this foot, here there are 4 important actions. What are these 4 important actions? Ye dorsal side bola tha maine, right? For example, if I am flexing my dorsal side, all of you look here. if I am flexing my dorsal side, क्या हो रहा है? यहाँ पे the angle is decreasing. It means dorsal side you are flexing. This is also called as dorsiflexion. Right? When I was teaching you here, I told you we have got two important things, dorsum and plantar surface. This is a dorsum, I'm flexing it, this is called dorsiflexion. This is the plantar, I'm flexing it, this is called as plantar flexion. So two actions, dorsiflexion and plantar flexion. हो गया? उसके बाद, if this is a foot, right? This is the midline. Now what I'm doing is I'm showing my plantar surface towards the midline like this. ये देखो, this plantar surface I'm showing towards the midline. This is called inversion. What is this called? Inversion. Okay. अगर plantar surface को मैं away from the midline दिखाया, if I'm showing my plantar surface away from the midline, this is called eversion. Okay. If you look at the picture over here, you will understand it clearly. है ना? ये देखो. Look at this picture. What am I doing? I'm decreasing in angle. Okay. Decreasing angle is called dorsiflexion. Okay. Dorsiflexion. ये देखो. Here I am decreasing in angle. This is called as plantar flexion. सर प्लांटर फ्लेक्शन को मैं डॉर्सी एक्सटेंशन भी बोल सकता हूं. यस, क्योंकि यहां पे एंगल इंक्रीज हो रहा है ना. राइट? ऑन द डॉर्सल साइड देयर इज एक्सटेंशन, ऑन द प्लांटर साइड देयर इज फ्लेक्शन. राइट? वेरी गुड. नाउ यहां पे देखो, इफ यू आर शोइंग योर प्लांटर सरफेस इनवर्ड, इनवर्ड मतलब ये देखो, ये मिड लाइन है, यू आर शोइंग टुवर्ड्स द मिड लाइन, सो दिस इज कॉल्ड एज इन्वर्शन. एग्जैक्टली अगर ऑपोजिट दिखाया, दैट इज कॉल्ड एज इवर्शन. That is called as eversion. All of you understood, guys? Every one of you understood all the basics which I have discussed now? Everyone, right? Be frank. Because I am the one who is going to come to your universities and going to teach you anatomy. Okay, not only anatomy, I also teach other subjects as well, right? But anyways, we shall have those sessions another day. But jo bhi hai, so you understood everything, right? So actually this is an introductory part, hai na? I cannot draw each and everything. Basically I draw and teach. Okay, that is when a single picture speaks 1,000 words. I hope all of you know. So basically whenever I teach anatomy, I draw everything, I make the students to write the notes and teach. So that interaction is at a different level. That is a different, the topics are also at different level. Okay, so this is just an introductory topic. So that is why I've used this presentation. I thought this presentation would be best for you to understand. Okay, now what I'll be telling you is, when you are entering into your first year, ठीक है, जाने से पहले, I don't know if your tickets are booked or not, whatever it is, जाने से पहले buy some books. Okay, I'll tell you some books, so get those books, so that would be helpful for you. Yes, Najbul, मैं offline classes ले रहा हूँ in Kyrgyzstan. Okay, I'll come to their live interaction I'll have with the students. ठीक है. So all of you, just now I came from Kyrgyzstan and Kazakhstan also. I've taken classes already there and I've just come here. So all of you look at this. For anatomy, guys, I would recommend Vishram Singh. Why am I recommending Vishram Singh? क्योंकि इसमें ना the pictures are one-liner diagrams, so it is very easy for you to understand. You look at the picture, open the picture and study the text. Okay, and compare with the picture. This is what you need to do. Don't study the test blindly without looking at the picture, specifically for anatomy. Okay, picture देखो और text पढ़ो, you will understand everything. And Vishram Singh is the best book. Okay, next, if you want a good clinical knowledge, है ना, this Gray's Anatomy student edition जो है ना, Gray's Anatomy का student edition, that is very very good. Okay, but don't worry about that. We will put the links of each and every book and their details in the Telegram group. ठीक है. So this is another best book. I don't want you to buy this book, है ना. ये ना इतना मोटा book है, that will cost you a lot. Better get a PDF. That is more than enough. But for these books, you have to buy these books. Okay. So after this, न्यूरो एनाटमी के लिए स्नेल्स क्लिनिकल न्यूरो एनाटमी. सर वाई क्लिनिकल? अभी फर्स्ट ईयर में आई एम टेलिंग यू हैव टू स्टडी एवरीथिंग क्लिनिकली. मैंने कहा था, है ना. सो यू हैव टू स्टडी एवरीथिंग क्लिनिकली. सो स्नेल्स क्लिनिकल एनाटमी वेरी गुड है, क्योंकि इसमें जो इमेजेस दिया है ना, दे आर वेरी वेरी क्लियर एंड वेरी वेरी नाइस. ओके, सो दिस इज अ वेरी इंपॉर्टेंट बुक. नेक्स्ट, कमिंग टू एम्ब्रियोलॉजी, मैंने बोला डेवलपमेंटल एनाटॉमी करके एक होगा, दैट इज कॉल्ड एम्ब्रियोलॉजी. आई वुड रिकमेंड इंदरबीर सिंह, IB सिंह, ह्यूमन एम्ब्रियोलॉजी. दिस इज वेरी गुड बुक, है ना. So if it is better you get two books, okay, one is human embryology Inderbir Singh, one is clinical embryology by Vishram Singh. Sir, what is clinical embryology? Clinical embryology matlab, for example, at 8th week jo development hona hai, if it did not happen, right, or let us say at so and so week that development did not happen, the neural tube did not close properly, the neural pore did not close properly, the baby will be born with neural tube defects, है ना, spinal, the brain will be outside, right, the meninges are protruded outside, the CSF are protruded. So these things are coming under the clinical embryology. ठीक है. BD Chaurisha is very helpful, but the reality is that no one opens BD Chaurisha. ठीक है. So because in BD Chaurisha everything is so complicated, muscles, nerves, osteology, myology, splanchnology, you know, everything they'll put at one place and explain you. That would be a little bit of torture, you won't understand it. इसीलिए basically everyone uses BD Chaurisha only, ठीक है. But to make the things easy, I'm telling you to use this Vishram Singh. If you have BD Chaurisha, if you're okay with that, then fine. If you haven't bought any book, then go for Vishram Singh, ठीक है. नेक्स्ट हिस्टोलॉजी के लिए दिस इज व्हाट यू नीड टू रीड, इंदरबीर सिंह हिस्टोलॉजी. ठीक है गाइस, आई हैव ऑलरेडी मेड ए वीडियो ऑन द चैनल कि एक एक सब्जेक्ट फर्स्ट ईयर में जो सब्जेक्ट्स है ना, एनाटॉमी, फिजियोलॉजी, बायोकेमिस्ट्री, राइट, एक एक सब्जेक्ट हाउ यू हैव टू रीड, हाउ यू हैव टू अप्रोच, मैंने बहुत क्लियरली आई हैव ऑलरेडी टोल्ड देयर. Okay, so after this, if you have time later on tomorrow or day after tomorrow, you just watch that video. Okay, so histology, this book is good, and I also told histology how to identify the slides and all. Okay, right, so this is all you need to know here. Yes, Karma Gaming, I'll also teach neuroanatomy, guys. So tomorrow, so today you have understood enough basics. What I want you to do is just revise. Abhi revision mat karo. Tomorrow early morning when you get up, you just revise it, क्योंकि कल भी live session होगा, and tomorrow I am going to teach you joints. When I teach you joints which you studied in your 10th and 11th 12th standard, this is going to be so interesting. But MBBS में joints में जो बताऊंगा ना, I will add some clinical points, I will put an MRI scan, I will put a real patients and all, and then I will teach you. You will understand how to study in MBBS, okay, how to clinically correlate everything. So all of you love the session, guys, all of you love the session, yeah. Very good, very good, thank you so much, thank you so much. So this PDF also I will send it in the group, okay, so that you can revise this PDF also, okay. So very good, guys. Yeah, it is gonna be more interesting. I promise you tomorrow's topic will be more interesting, because there will be a lot of pictures which I will draw, explain everything and all, है ना. So yeah, guys, thank you so much for attending my session. Thank you so much, and all of you, all the best. And always don't become a normal doctor, always become a doctor with a good clinical practice. That is what makes you a difference from another doctor. So all of you take care, good night, and get good sleep.